Cytomegalovirus, better known as CMV, is the most common viral infection and is the leading non-genetic cause of hearing loss for infants born in the United States.
Now, every pregnant woman is at risk of acquiring CMV, and only 9% of these women actually know about it.
Joining us now for more insight on CMV is developmental pediatric specialist Dr. Megan Pesh from CS Mott Children's Hospital in Ann Arbor. Doc, thank you so much for being here tonight.
Thank you for having me.
So your daughter was born with this. She is now 4 years old. Can you tell us just what you went through during this entire process and what this disease CMV is?
Completely, yeah. So CMV, cytomegalovirus, it's a mouthful, so that's why we say CMV. It's a common cold virus. Most people in the US end up getting it at some point. Most of the time it causes absolutely no symptoms. Maybe someone would get like a sore throat, but really in general, we think of it as kind of a no big deal virus. The one exception is if a person gets it when they are pregnant or right before they become pregnant. Then while in the mother, the virus doesn't really cause symptoms, it can be transmitted to the growing baby and cause damage, especially in the brain and in the ears. And so that's what happened in my case. We didn't know, and I don't remember being sick during my pregnancy. It was my third pregnancy, very typical. But when my daughter was born, we found out shortly thereafter that she was deaf. And that led us kind of down a rabbit hole of tests, and we found out the cause was, in fact, CMV.
So how does somebody go about finding out if they have been or are at risk, obviously, for CMV? Or what are the tests? How does this even come about, the knowledge needed to know what could be happening to this baby before they're born?
Absolutely. So sometimes doctors can tell if there are changes in the baby's growth by ultrasound. A lot of the time, they don't know until the baby is born. When babies are born, a lot of states are actually starting to screen babies for this virus because there are treatments available, including antivirals for some babies, but also just really close monitoring, knowing that 1 in 5 of babies born with CMV will lose their hearing at some point. And we're not just talking about a rare virus. This is 1 in 200 US babies. There are a lot of babies born in the United States with congenital CMV, but we just aren't talking about it. So how do you get tested? Well, if you're pregnant or thinking about becoming pregnant, absolutely talk to your healthcare provider about it. There are things that you can do to lower your risk of catching the virus when you're pregnant. Unfortunately, a lot of times the pregnant mom will catch the virus from a toddler or a kid at home. And so trying to avoid contact with a child's saliva, not sharing food, drinks, trying not to kiss a young child on the lips. Those are things that pregnant people can do to lower their risk. But it's always a good idea to start by talking to your doctor.
So I'm trying to understand this. So you didn't know when you were pregnant that you had this, and you don't find out until after your daughter is born. At what point do you find this out?
Yeah, so with her, now she's 4, so things have changed in Michigan since that time. But we didn't find out she was deaf until she was about 2.5 months. At that point, we figured, well, it's probably from a genetic cause, just because that is the most common cause of hearing loss in babies. But then we did some more testing, and it wasn't probably until she was about 4 months old that we figured out that she had CMV. And the issue with that, although 4 months might sound young, if we know a baby has CMV and we can find out and get them antiviral treatment, for the babies who qualify for that treatment within the first 31 days of life, so early after they're born, those medications have been proven to improve these babies' hearing outcomes, long-term developmental outcomes, at least into the toddler years. That's where the studies are. They've only gone that far.
And is that where the antibiotic, I think it's, what was it, the CDC calls it, valganciclovir, I think is one of the ones that it says that they used to treat. I mean, where you were saying some states not all, but
Some
some
states.
states are starting to test for this. I mean, is this not a mandatory test? Where does Michigan stand with this?
I know. So Michigan, not yet, but gosh, we are working on it. And I know Michigan, as a state as a whole, our values, we're really dedicated to maternal infant health. And so I hope that this will be coming shortly. There are many hospitals in Michigan that screen babies who fail their newborn screen, but it is not a state mandate. This is in contrast to, say, Minnesota, where they screen every single baby. So Michigan has a ways to go, and I'm hoping that we can work with our policymakers to, make this just standard in Michigan.
So if
And
oh sorry
mhm,
sorry off of what you were just saying there as well, if it's something that's not necessarily like required in the state of Michigan, do you know if this is something that, I mean, the question always comes back to, is it something that insurance companies would cover if it's not
mhm.
required?
Yeah, so we haven't had any issues with that. The test itself is very cheap. It's just a saliva swab, which, like it's similar to a COVID swab. It's just a little cheek swab for the baby. We can also do a pee test. So it's a pretty cheap test, about $43, but we have not had any issues with insurance companies covering it.
You talk about only 9% of women know about this, and there's just not enough, knowledge surrounding this disease. Do you think this will bring awareness to others to get tested, whether insurance covers it or not, and whether there's legislation for it at some point here in the state of Michigan? How crucial is it to add this to the layers of tests that women get when they're pregnant?
Yeah, so that's a great question and also a complicated question. CMV, it's one of those viruses like COVID, like the flu, that you can get again and again. You can get different strains. So testing for CMV in pregnancy can sometimes be tricky because if you test a person and they come back as having had it in the past, well, they're not completely immune because you could get another strain. So, that's why we really emphasize these kind of risk reducing strategies in pregnancy. So, avoiding contact with the saliva and urine of young children as much as possible, doubling down on that hand washing, trying not to do the thing where the kid drops their pacifier and you clean it in your mouth, which is, I know, kind of gross, but a lot of parents, we do it. So that's kind of the biggest message, and we're hopeful too that in the coming years there are some really promising vaccine trials coming down the pipeline. So I hope that in my daughter's lifetime this will be, a long forgotten disease.
So let's jump back real quick to what you're talking about, like if it's detected, especially after they're born. So let's say we are, or it's a new parent that the baby has been born. They have found that the baby has CMV. So what happens from there? Can you walk us through the steps, like either treatment-wise or even past that point? What ends up happening now at
Yeah.
that point?
Yeah. So I think the important thing to know, because, if you Google anything, gosh, it looks so scary. But most babies with CMV do very, very well. But there is that, 1 in 4, 1 in 5 who will have hearing loss, who will have kind of those longer term, more severe developmental complications. And so if someone has a baby with CMV, we are going to start monitoring that baby really closely, following their hearing, getting early intervention involved. We also do a little ultrasound through the baby's soft spot to look at their brain. And sometimes, if we see some suggestions to make us think that maybe the brain had been involved in the infection, then we'll often do antivirals, which, are not like a miracle drug, but they have been shown to help in those kind of more severe cases. So it's really pairing with your audiologist, your early intervention team, to really monitor these babies and support the families too.
Well, Megan Pesh, we appreciate you joining us tonight. Hopefully this begins the conversation
Yeah.
and educates people on what CMV is, how it can be prevented, and things to look out for. And hopefully it opens a conversation for mothers to get checked and to ask their doctor for screenings.
Thank you so much for having me.